So today in the clinic, I had a patient come to me that has been suffering from decreased libido for like years. And she was actually following up after a month. So I had seen her before and we talked a lot about mindfulness. We talked about sensate focus. We talked about her relationship. And then I had ordered some blood work on her. So today she was following up for that blood work, and that blood work came back and everything was normal. There was no decreased testosterone. There was no increase in her something called sex hormone binding globulin, which will bind up that testosterone and decrease that testosterone in the body, which can lead to a decreased libido. So everything was coming out normal. So then we started talking about all the different things that could affect libido. So we know that for a decreased libido, it requires multifaceted approach. We have to take a look at the biological, the psychological, and the social aspect of a person to really get to like the root cause of what could be causing that decreased libido. So I started asking her, she's 31 years old. She didn't have any other medical problems. She wasn't on any other medications. So it wasn't that. She didn't have any anxiety or depression. Her relationship was really good with her partner. She said they had a really good open communication in their relationship. She was able to tell him what she wanted, what she desired. So everything seemed okay there. And then I was sitting there thinking, and I thought, I asked her if she wanted to see a therapist, and she said, yeah. And then she started talking, and she said, when I was young, about 6 years old, I had experienced some trauma. She had experienced some child abuse, child sexual abuse. And so she had never really been able to talk to anyone about it. And right then and there, I wish she had told me that, earlier on in the conversation, because absolutely, that can absolutely affect her relationship, absolutely affect her libido. Every time she started to become intimate with her partner, she had these thoughts of when she was younger. And so, until she's able to process that grief and to really understand what happened to her, then can she move forward in her relationship, right? So she's holding on to all this grief and trauma, and she's not able to move on in her relationship. So, I definitely referred her to a therapist, and I explained to her what was going on. And so that's why it's so important for us as clinicians to ask our patients questions, right? And to really figure out what it is that is holding them back. And when I was able to do that, and when she was able to feel comfortable enough to tell me, we were able to then figure out a plan for her to move forward. So really important to try to be open with your physician, let them know what's going on in your life so they can really help you.